Hi. I actually wrote this down because I don't want to get too overly emotional. Good morning, Chair Cody and members of this committee. My name is Paulette Chaussee, and I am testifying in support of House Bill 2572. In a matter of months, my 15-year-old granddaughter, Keziah, went from being an A student taking AP classes, playing club volleyball, and loving her family, to a full-blown psychotic meth addict living on the streets. In 2016, with help from local police, we were able to get our hands on her, and they agreed to take her to the emergency room, kicking and screaming, where they then refused to treat her because it was a substance use issue, and sent her home with us. After a long night with Keziah, she went in and out of delusions, hysteria, rage, sorrow. She finally agreed to treatment. We spent hours in the morning trying to find a secure detox or treatment facility that would take her. We had to find a place, first of all, that had space available, and then it had to accept our insurance. I'm also with Kaiser. And then that insurance company had to approve the actual facility. It had to be on their list. And then once all that was straightened out and we found a place, we were told there was a 3-day waiting period. We knew that a 3-day waiting period meant she was going to be gone. It wasn't going to happen. The only thing that saved her life that day was an out-of-state secured juvenile facility that had treated her previously. We called them and they said, and I quote, "Just get her here and we'll worry about the insurance later, even if we have to keep her in the bathroom until we can officially admit her." They knew the danger of forcing us to wait for 3 more days. Sadly, Keziah, who's now 18, has relapsed. Several times over the last 6 months, she's reached out to us for help. Recently, she showed up at my house in the middle of the night crying, saying she was done and ready to go to treatment. She stayed overnight. By the next morning, she had convinced herself once again that she could get clean on her own, and she didn't need to go anywhere. It's absolutely devastating to see someone you love walk out the door and back to life on the streets, not knowing if there'll be another chance to save them. Representative Cody, I want to thank you for being a champion for recovery, and specifically for this bill. And I'm asking that you do whatever it takes to remove one additional barrier to our loved ones getting treatment when they say they're ready. Thank you.
Hi, thank you again for having me. I'm Michelle Carrere. Our family's introduction to opioid addiction started in 2009 when our 16-year-old son AJ had an accident at school, which resulted in a life-threatening traumatic brain injury. He was prescribed strong opioid medications while in ICU and sent home after a week in the hospital with several months refills of the same opiate-based medications. Since that injury, my son has struggled with opioid addiction in various degrees, eventually leading to heroin addiction. Over the past 5 years, my son has reached out to his father and I for help to get into detox and inpatient treatment, only to be told by detox providers that a bed will be available when an assessment or referral is received by a doctor, and with pre-authorization from the insurance company. And going from detox facility to inpatient care requires additional pre-authorization. Recently, just last year, we tried to get our gravely ill son into inpatient addiction treatment. Our private insurance would not authorize inpatient care. Our son met medically necessary criteria and was at extreme risk of death without treatment. We ended up having to pay out of pocket $20,000 to send him to treatment because insurance refused the inpatient stay. The window of opportunity is very short when someone with substance use disorder wants help with their disease. If treatment options are not readily available, the craving of their addiction pulls them back into that life of actively using drugs. Removing pre-authorizations after a healthcare provider deems a patient medically necessary for detox and treatment, and requiring insurance plans to cover these acute stabilization services gets the patient the life-saving care they require with little or no delay. Those patients, each and every one of them, is someone's everything. AJ is mine. He's my precious, precious child. I encourage you and ask that you would pass House Bill 2572. Thank you again.
Okay. Michael Hatchett, Katie Colin, and Brad Banks.
Madam Chair, members of the committee, my name is Katie Colin, here representing the Washington State Medical Association. I'll keep my remarks brief. Patients, when they've been met with these barriers at a critical moment when they're ready to receive help for substance use disorder, the time is fleeting. They need to get in. My understanding is that there are some negotiations